Today we are bringing together people from across our PHN with expertise in so many different fields to build a computer model of our healthcare system.
We have the great pleasure of coming here to a beautiful region in order to try and help with the PHN's mission and trying to engage with and help improve mental health for the purpose of avoiding a human and societal tragedy, which is suicide.
This computer model will help us with our commissioning for the PHN. It will help us to have evidence-informed services that we commission onto the ground. And the exciting thing about this is the priorities that we get out of dynamic simulation will have come from a co-design process with our communities.
You don't want to be driving while looking in the rearview mirror, but that's what existing policy tools are. They use historical data and assume the future is the same as the past. And that's simply not the case. So dynamic simulation model brings together computational ability and also technical skills, and through that human process maps out what that future looks like and allows decision makers to engage just as you would with driving a car, to make the right turns at the right time and press on the accelerator to make sure you get across that journey as quickly as possible.
Expectations coming here today were really to understand from a community perspective. I'm expecting that we'll be hearing from lots of different voices in the community about how we can make a real difference in the future.
I had a great expectation today to work with others using my lived experience and finding some positive formulation for how we can reduce suicidal deaths in our region.
Suicide is a multidimensional, multi-sectoral problem. It's something that we all share. We all have a part to play in its causation, but also its solution. And so I came to lend a hand. Now I understand the challenges, and I thought today might be a wonderful opportunity for us all to talk together.
We really want to make sure that the modelling captures the community involvement. So we know what we need to do within the hospital, and we know that the model is going to help us with that. But what we really want to see is how we can engage the community and how the model can capture that community involvement to reduce suicide.
We're so excited about what's been happening in between Workshop 1 and Workshop 2. We've been out to the community, finding out what their priorities are for interventions for suicide prevention. We sent out a survey that was developed by this group here from Workshop 1, and it went out and we had over 100 responses. We don't get that kind of response in suicide prevention, so we're quite excited about how that went. We also had lots and lots of feedback on the map that we created within Workshop 1, and now we're putting the final touches on that now in Workshop 2, ready for the model to be run.
The first workshop was about clarifying the current situation in terms of the roadmap in front of them. Workshop 2 is about then trying to clarify the interventions which can change the journey that we've been going on historically. So it's about introducing new interventions to try and then give the population more options, more service options, and better quality service options.
And the first time I was like, oh, this is like a suicide prevention experiment, like sort of virtual experiment. So you can actually see if we put in this intervention and we're able to do it at, get this effect, then what happens if we put in this other one and this other one, and what's going to have the biggest impact in what time frame. So that's been really exciting.
Yeah, the 2 workshops so far, we've been provided with some information around what system dynamics modelling is and how that can be used to transform the way we plan and then put together our service delivery at a community level. It's great to have all different diverse members of the community and different stakeholders.
For a lot of Aboriginal and Torres Strait Islander communities, it seems to be a little bit of there's a gap, and we're trying to link in a more holistic approach with services, more about healing and with the clinical aspect of what's been delivered. It's great to hear from Aboriginal people and communities of what they feel they need.
So I've been doing a lot of work around the PHN dynamic simulation since the last workshop. So we've been out and about talking to a lot of people, largely to have a rural focus and a rural input into what's happening, so that when the PHN are looking at commissioning services, that they can take into account a more rural perspective.
We'll continue to see and hear from all of these diverse groups into Workshop 3. So we're here at Workshop 3 and we have just showed the participants the model for the first time. There's been a lot of excitement around this and people are sitting here engaging with the model, seeing what works, what doesn't work.
The energy in the room is tremendous. The goodwill something unprecedented, and we're making great progress. So essentially the workshop was about taking the group through the almost finished prototype. So really test casing.
We really value this process because we learn a lot through it, and we find out information that can't be found in any academic papers, and it really helps make the models more robust and contextually relevant and fit for purpose.
Since the last workshop, we've been working really hard to really clarify what each of the interventions are, making sure the feedback from both the workshops and the participants from around our region is really embedded in what we are going to be putting through the model.
So just to recap, the policy model is like a sat-nav for the PHN. It's trying to map out ahead policy options and where we go by taking one option and not the other. And what's been fantastic for me as an economist is going through that process and learning also. Now we're at the stage where we can start to pour some petrol into the tank. Now what I mean by petrol into the tank is that how much resources do we need to invest in programmes to reach the destination that the PHN and collaborators want to get to. And if investment is insufficient, if we don't put enough gas in the tank, what might the unintended consequences of that be?
And each project is a little bit different, the stakeholders are different, aspects or characteristics of the system are different, so it's really important that each model is really grounded in local context.
You know, to be here and to be around people of high calibre and forward thinkers in their area, it's been amazing for me. I was just mentioning about data and reporting in our Indigenous and Torres Strait Islander communities. It's you know, we need to increase the data. We need more information out there, and we need more people to start talking and sharing this information with us, so we can create processes to limit you know, what's going on out there. So you know, our mob out there have got broken spirits, but you know, through processes like this, we can become emotionally well and become mentally well. And you know, I'm looking forward to what's in store and what the future holds with the right input from the right people.
Just looking at some of the more holistic approaches that gets missed from mainstream services, especially directed at mainstream services, but also directed at Aboriginal people as well. And so the modelling, this is the third workshop, and it's really nice to see the actual trial of some of the models and really shows exactly that the holistic, more health promotion, the more preventative treatments actually have a bigger impact on suicide outcomes. And it's important, I think, for funding bodies and people to see that.
Obviously, suicide is a huge problem. It's unfortunately an increasing problem. And I think any efforts that are made to tackle it in a evidence-based and logical, rational fashion are useful things to undertake.
These things at times can be a little bit abstract until we start interacting again with the user. So it's really bringing together a technical process, but being reminded that it's very much a human process.
That's what this is all about. It's about sharing experiences, and you know, if somebody's got a part of the jigsaw puzzle, why not you know, not try to create your own. Let's use what's working and put it around other valuable pieces so we can get the final picture.
So the final steps for this process is to have a regional symposium in February, where we're going to share our results that we've found through these workshops and through the model with the rest of our community. The community is then going to have a chance to know what we've been doing for the last 6 months and really get a hold of what the plans are for suicide prevention in the Hunter New England Central Coast region.